Hello, look who I have here. Thank you, Dr. Katherine Hertlien, for being here. And I'm excited for this conversation about AI for the International Journal of Systemic Therapy. So thank you for your time and for being here.
Thank you so much for inviting me.
Of course. So I know that you are the one person that we should go to if we have any questions about AI and family therapy. But how about we start with how do you see AI reshaping the practice of couple and family therapy in the coming years?
I think it's going to shape our field in many different ways. I think one of the primary ways that I often get asked about it is what happens in terms of tools, right? What opportunities do these tools give us? And I think what we've been seeing is you have people who are using it for some kind of case note situation. We have people who are using it as a way to maybe support a diagnosis, confirm a diagnosis, or even maybe even get in the right track in terms of where a diagnosis might be located in that large book in the DSM.
Mhm.
We can think about ways in terms of getting an insight. Maybe is there a pattern that needs particular attention? Is there something that the therapist should be paying attention to but isn't? How do we create a letter for a case file? What would that look like? So looking at the tools in one way, a second way might be some of the expanded access. One of the things that telebehavioral health and the internet has done for many healthcare operations is it allows us to be able to provide coaching and asynchronous support and synchronous support from a distance to better reach families that maybe don't have access. I would expect that to continue with AI.
Yeah.
Another way that AI think, is shaping couple and family therapy is the identification of a new actor.
Mhm.
And what I mean by that is, I have talked in the past when the internet came into people's lives about it being an entity within a couple's relationship. You have to think about this machine in between these two people and how it's governing a lot of their interactions. That focus for me has not changed. We've continued to interact with technology in that way. Many years ago, when it was just the internet, couples would come to us and they would describe the issues that they were having with this entity in between the two of them because it was creating some sort of issue or they were using it in ways that weren't helpful to the relationship.
Mhm.
But over time, that technology has come into the clinical space.
Mhm.
It is a new thing in the space. We have people who are recording sessions and not telling the therapist. We have therapists that are recording sessions and perhaps not telling their supervisors or their clients,
Yeah.
unfortunately, right? We have ways where we're inviting the technology to do a case note, which means that it might be listening to some of the session or it might be summarizing some of what's happening to be able to provide supporting points
Mhm.
for a summary or for a case note. It is a new actor in the room, and we have to deal with it like it's this entity. If you even think back to the work that Dr. Twist and I did, we wrote about this a little in our book about the technology genogram. You might remember that we put a phone in the middle of that genogram.
Mhm.
It is an entity that needs to be managed in the room. And I think if we can, as a field, understand that that's really the place that it holds, then we'll understand better the implications that it would have for couple and family therapy.
Yeah, of course. And that's huge. And sometimes it surprised me and shocks me that I still like walk in rooms and talk with different people in the field, in academia and outside academia, and they still like try to ignore the fact that AI is here. And I feel like we cannot ignore it, right? Because it's here, it's not going anywhere. So it's up to us to be competitive with the whole world out there, right?
Oh, yes. Oh, yes. It is a marketplace issue. I
Yeah.
have said this before, I'll say it again. If we don't move with this technology and find a way to responsibly integrate it into our care, we are going to be left behind. Clients are already using the technology, and the expectation is that their therapist will be able to hold a candle to what they're being told in other spaces online. So we have to make sure that we show up to the table.
Exactly. And there are all these different surveys that show that many clinicians, they know that there's something out there, AI, and it's going to change the field. But most of them, they say like they're not familiar with AI and they don't have the competency to work with it. So that is actually the reason that I reached out to you for today's conversation, because I know that you worked on this AI competency for the, systemic therapist. And I know that I'm so happy about that. I use that, a whole framework in many different talks that I had with your permission and with, obviously citing you. So could you please tell us about this AI competency? What does it mean for systemic therapists today?
Sure. When I think about competencies, I think about how do we identify what is the knowledge base that people need to have to be able to be effective?
Mhm.
What are the skills that people need to be able to be effective? And what are sort of the ethical and legal understandings so that we can be effective and make sure that we're delivering care in a safe way, in a way with intentionality, and in a way that is equitable.
Mhm.
So when I developed the competencies, I tried looking at all of these different competency documents that are out there.
Mhm.
We have to entail the ones that relate to couple and family therapy. So
Mhm.
those are going to be ones that do overlap with knowledge, skills, and ethics for sure. But we also have to recognize that AI is coming from a telebehavioral space, that there is some intersection with technology. If you listen to Gregory Hinton, who is the known as the godfather of AI, he talks about a couple of different elements and shifts that have happened that have really enabled AI to come to the forefront. One of them is the size of the transmitters and the size of the processors. They've been decreasing and decreasing in size. So that has helped. But a second thing is data. AI and large language models in particular require massive amounts of data upon which they train themselves to be able to recognize certain things. So, here as couple and family therapists, while we may have a lot of competencies when it comes to sitting with people and speaking with people, we still need that skill set about technology. We need the knowledge and we need the skills and we need to understand the ethics behind it to really be effective in the space of AI. And
Mhm.
then finally, coming from a healthcare perspective, there are some conversations happening about AI in medicine and AI in healthcare as it's moving toward personalized medicine, which is what people are looking for. How do we wrangle that? And so there are some competencies developed from the healthcare perspective about here's how to use AI in healthcare generally. So the competencies for me were developed from those three sets of competencies. We have to have some technical skills. We have to know how to work in healthcare generally. And then we need to understand from an MFT perspective, what's our unique skill set and how do we still be competent in that? Those competencies emerged into a document or into some of those competencies where I'm really focused on a couple different pieces. First, I'm focused on learning the foundations of
Mhm.
AI, but with those foundations also comes the limit. What are the limits to what AI can do? I
Mhm.
get very concerned when I work with learners who sort of put everything into chat, or even clients
Yeah.
who even put everything into chat GPT or a different kind of system, Claude, Copilot, system doesn't matter. But if they're relying on it to do everything, you have to really understand what the limitations are. What can it do? What can't it do? And when is it appropriate to use and in what circumstances? A second thing that I like about the competencies is that I focused on the relationship piece. We are so good at relationships, and we have built our entire discipline on systems. Why we wouldn't look at this system and integrate it too into what we do when we are really the experts in the room on it was beyond me. And so a lot of the competencies have to do with, well, yes, how do you work with AI? But also, how do you work with AI? Number one, when AI is an entity in that space.
Mhm.
And then number two, when AI involves and interacts differently with different demographics, different age groups, etc. One of the things that AI is supposed to do is to be able to really make predictions and to be able to target particular demographics. I don't know about you, but I've certainly had circumstances where, I've gotten email alerts or advertisements about something very curious that I was researching earlier or had corresponded with someone earlier. Why would that randomly show up? Our technology is listening to us,
Yeah.
right? Like my husband and I were having a conversation about a shoe brand, and next thing you know,
Exactly.
this shoe brand starts being advertised on his phone. So the technology is listening to us, right? So how he interacts with that system versus how I interact become a main focus of some of these competencies. We
Mhm.
have to understand the technology in the room, and we have to understand how those relationships are intersecting with each individual and how it's targeting each individual and doing different things with it. And then finally, of course, looking at the ethical pieces, the legal pieces, which are far behind what's happening with the technology and developments. We have to be able to anticipate risks, anticipate the bias in the model, anticipate what we're going to do about keeping vendors accountable and keeping individuals who are creating these technologies accountable, when in fact the legal arrangements and the limitations that are going to be imposed from a legal perspective or from a policy perspective are far behind what's happening with the technology innovation. So how do we anticipate those? And in some ways, couple and family therapists have to really come to the table and understand things that perhaps we weren't trained before. We've got to be trained in technology at a basic level. We've got to have a basic level of understanding of perhaps how litigation is made and how policies are made. And we have to make sure that we're at that table when that's happening in service to our clients.
Exactly, exactly. So we have a lot to do, I guess. And
Yes.
and if we consider like the master level program for MFT, which is like the first level of training for MFT students, then like we should include all these different AI competency in our training programs. I think like that's the first step. And in order to do that, like the instructors and mentors and directors and all of us, we need to be trained in it as well, right? Because again, like one of the things that I encounter often is like people sometimes they don't like AI and technology, and I get that. You don't have to love it, right? But
Right.
because you hate it or you don't like it, it doesn't mean like it goes away. It's still here, and you need to still learn how to work with it, what it does, what it doesn't do, right? So because sometimes people they know it does X, Y, Z, and I'm like, do you know what it doesn't do? Like it doesn't do critical thinking, blah, 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 blah. So you need to be familiar with that. And you need to also be familiar with corroborating, right? So when you get a result from it, how you can, like cross-reference it and check it and make sure that it's accurate, right?
Mhm.
Um, so what do you think about which foundational AI skills should MFT students learn during the training?
One of the basic ones and one of the first ones that's talked about in some of the healthcare spaces as well as the TBH is we have to develop a new language. MFT and couple and family therapy students should be learning what terminology is, what it means, what are some of the common words that are used, what are some of the strengths and limitations of AI. That's part of AI literacy. They need to be able to write prompts in a way that are going to get them the answers that they want. AI systems were designed to solve problems. So if you can write a prompt in a way that asks a question that solves a problem, you're going to get a better answer. We need to develop ways to be able to verify what the AI is telling us because it can hallucinate. It can say things that are not true just to come up with
Yes.
answers, right? Because it doesn't want to say I don't know, right?
Yeah.
That's not part of how it's programmed. A second thing that couple and family therapy students have to learn are about data stewardship. So, what does it mean to really protect someone's information? I've been to quite a few trainings where people have said, well, yes, we're rolling out this AI supervision tool, and it's okay because we're partnering with, and they'll say a name of a massive company and organization,
Mhm.
and they'll say, but we have a BAA agreement, so it's okay. Hackers do not care
Yeah.
about your BAA agreement. When they get your information, they get your information and they're gone.
Yeah.
So we have to have different understandings of data stewardship and what's appropriate for our discipline versus what's appropriate for other disciplines. We need to understand bias recognition. Many of the AI systems have been trained on a particular demographic that doesn't represent the people that we see all the time.
Yeah.
So we have to be able to recognize what the reason that the information is coming out the way it is because someone who had particular demographics was sitting behind the screen and testing it on someone with their same demographics.
Mhm.
We have to identify what it is that's happening, where the biases are, and how do we ensure that the information that's coming back is going to be representative and fit the population with whom we're working.
Mhm.
There also has to be some basic information on data integration. When you're using it in your, and by the way, that cuts across lots of different areas that I've already described. So if you're using it for case notes, that's great. But how does that interact with the data stewardship and whether or not there's a particular bias?
Mhm.
Can you do role plays? There are quite a few places that are teaching micro skills with AI, and that's probably a pretty good use of it, right? So that's one way to clinically integrate, but you need to be able to edit for accuracy. You need to, perhaps as a supervisor, be able to go in and edit for what might be appropriate so it's not sort of making up stuff and
Mhm.
having the learner just submit things because they're not learning to trust their own intuition. So it's about clinical integration, not clinical takeover. One of the things I get concerned about is when learners are just entering this space and they don't have a lot of confidence. I don't know about you. I did not have a lot of confidence as a
Yeah.
master's level student. I was really very, very scared and thought, oh my gosh, this program made a mistake. I don't know what I'm doing here. Right. But I didn't have a system to be able to confirm my guesses or to rely on.
Yeah.
And my fear is that some of our learners who are perhaps anxious and want to do a good job and have all the best intentions are maybe deferring to the technology instead of using what I call the original chat GPT right up here, right? We need to be able to be discerning, and sometimes that gets lost. So it's about clinical integration, how to do that in a responsible way and not clinical overtake. We also want to make sure that boundary setting is in place. How do you talk with clients about their AI use? How do you talk with clients about them accessing you? This is not a crisis line. Maybe your work is, but mine isn't,
Mhm.
right? What are some of the limits? What are some of the boundaries? And then how do you make decisions about vetting particular tools? So I was on a committee that looked at the minimum standards for systemic apps, and we developed a tool for how to evaluate apps that we might refer to people. How would you evaluate whether that app fits or not? We still need to do a level of tool vetting and documentation. So learners need to understand that. And then finally, when AI fails, and it will because it was built by humans, okay, what do you do? How do you disclose an error appropriately to a client? How do you detect when an AI is telling you something that isn't actually true? How do you tell the difference? So those are some of the basic things that I would say we need to
Yeah,
learn.
yeah, and they are very important. So there has been this study about it's about research, not the clinical world, but in the research world, AI has been more helpful to senior researchers versus like junior researchers, and I feel like that makes so much sense, right? Because you already have the original chat GPT, you already have the skills, the knowledge, and then you can do that vetting and the cooperation like very well, right? So the result that you
Mhm.
get from AI, you have the knowledge and the skills to see that this part is good, this part is not good. Like I need to insert critical thinking, right? And when you are a junior researcher, maybe you don't have that experience and knowledge. And if like we transform the conversation to clinical world, I think like it's the same, right? So you still need as a therapist learn and know all these different skills and do
Yes,
not rely
for
only
sure.
on the AI. And I think that so far you already covered some of the ethical challenges that we might have. One of the things that like it's already happening, and I have challenged with it is like a lot of places that they use AI in therapy, either like for note taking, whatever it is, like they give clients informed consent. But I joke around it and I say like it becomes one of those like things that you sign up like on your phone or whatever. It's like so long that no one reads it, and there's somewhere in there that says like AI is. So clients they really don't know, and they are recording sessions. They are gathering all this data, and I think that that is not ethical. Like your informed consent should be clear, and clients should know what's going on in a therapy session. So that's one of the ethical challenges that I have right now with the different things that are going on.
I 100% agree. And I think it would be valuable. I do this in my own practice to have even a separate document, a separate informed consent about the technology
Yeah.
piece, and then kind of a treatment informed consent because the risks really do get amplified. I think if you pull out that information and put it in a separate document and review it with your client, you need to explain to them the way in which their information is going to be used. They have the ability, hopefully, to be able to opt out from that. I've got one client who doesn't want anything electronic, and so the notes are by hand. Great, perfect. But that is that individual's right to do that.
Yeah.
And I think we have to offer that to our clients as well so that they're clear on where their data goes. And we have to explain all of that in perhaps a document, maybe even talking about some of these systems are not regulated. Some of these systems do not have the evidence base yet that perhaps some of the other modalities we use might, and just to keep that in mind.
Yeah, exactly. I have another question for you. So a lot of times, I bet like it happened to you as well, that when you have conversations about AI in our field, some people again that who are not a huge fan of AI, they are so scared of that, losing that human and relational aspects of therapy. I want to know what you think about that. And I also want to add one experience that I had. So I was at a talk and I was showing a demo of AI supervision to the audience from one company. And I just wanted to have a sense when we are talking about all these different things, what it looks like, right? And then I was showing the video and everyone was like, they didn't like it, right? And I had the first reaction the first time I saw like the demo. But what I told them is a lot of times when we are talking about AI, we are comparing AI experience with the best of the best human experience that we have. So you're comparing the supervision with the best of the best supervision that you had with a human being, whether either like if you are the supervisor or you had a great supervisor. And in reality, that doesn't happen. Like I've heard so many like very horrifying story about supervision that like people like they get their supervision in these different ways that like it's really the quality is really bad. And if I want to compare like AI supervision with that, honestly, I would say it's really good, right? Compared to those stories. So
Mhm.
I don't know like is if that's helpful or not, but I just wanted to share that. So what do you think about that human and relational touch when it comes to AI and therapy?
Well, I think you said it brilliantly. If we look at the research, even just on telebehavioral health and teletherapy and internet care, the couple and family therapists were very concerned about preserving the relationship. But if you ask the clients, many of them preferred it. And they preferred it because they felt like because there's this screen here, there's some barrier to being judged in person. And therefore, they could be more open, they could be more vulnerable, they could say more things
Yeah.
because there was this what they perceived as kind of a barrier, and they had some level of protection, right? And it's the same thing we use when we're texting with people, right? If they can't see us, then we can disclose more because they're not there to judge us because they're not this in-person interaction. So I think if our main issue is we want to be operating in the service of the client, what does the client want and prefer? Does the client get a lot out of these interactions because they're the type of client who feels like they can be more vulnerable and say more about what's going on for them? Or does the client experience it as a barrier and doesn't feel like they can have kind of that human touch and human interaction?
Mhm.
For me, leaving it up to them to decide. Part of the fear, I think, around some of the AI is there's this impression that the AI is going to sort of take over somehow.
Yeah.
And I think if we're able to return that control back to the client and the therapeutic relationship, then people can decide what's going to be helpful for them. Another piece is that we want to be transparent. There is no way that a client or therapist can decide whether that system is going to be operating best for them unless we really understand what's happening, right? So we have to maybe be more transparent about what we're using, why we're using it, how we're using it, and put in some kind of guardrails, some
Mhm.
kind of regular audits for, is this working for you? Is this not working for you? Right? If it's not improving the alliance, if it doesn't seem like it's improving the therapeutic outcome, then don't use it. Right?
Yeah.
Go back to use something else. Another piece is with that relationship. There have been a couple articles that have talked about whether we're using AI exclusively in treatment, whether we're using AI as an adjunct, whether we're using AI to deliver treatment, but it's sort of human supervised. And AI might be really good in terms of preparing what might go on in a session, but ultimately, humans are the people who are deciding. Humans might be the people who might be able to offer that repair. There are a couple articles that, one in particular, that I'm thinking of that talked to, that asked people to rate a therapeutic response,
Mhm.
and they had an AI system producing or a chatbot producing a response, and they had a therapist producing a response. And the participants gave higher metrics or gave higher scores, more positive scores rather, evaluations to the chatbot response. However, They thought the chatbot was the therapist. Okay. And it had to do with the level of empathy that was communicated and, frankly, the number of words that were used.
Yeah.
Right. And we see that. I've seen that in the research for many, many years. I started my undergraduate career looking at personal ads and length of words for people who had particular medical statuses, right? And people who felt like they had to explain their medical status had a longer word count than people who didn't, and that had different implications. So there are ways to be able to say, well, what really are clients looking for in this experience? And can we as therapists match that in a way that we feel like we're maintaining the relational core of our work?
Yeah. I think one of the things that I hear from your conversation is we need to be obviously mindful, careful, thoughtful. At the same time, a little bit sometimes I feel like more humble because sometimes the conversations that I'm part of, like I feel like when we are like very so much like advocating for non-AI tools, it's because it's like good for our own ego. Like it's good that I'm in this room and I feel like I'm such a big person, like therapist or whatever. And because of that, I don't want anything to do not disrupt that perspective or picture for me. So like being mindful, thoughtful, like educated on all these different things at the same time, a little bit more humble about what actually is helpful to our clients. So it's not about us, it's about the client. So do you think that like with what you're saying, do you think that AI contribute or challenge cultural humility in therapy? Like which one of them, both of them?
I think so. So I think one of the it contributes in that it provides ways to be able to personalize psychoeducation
Yeah.
for clients from particular backgrounds. Maybe it reduces some level of jargon. And again, we're always going to be met with that issue of you can scale access in a way that is just astronomical, yeah,
Mhm.
and exponential
Yeah.
compared to me trying to do all of this work,
Yeah. Mhm.
right? You can scale it in a way that we have never seen.
Yeah.
It also contributes in that, you might be forgetting a particular part of the way in which you do case notes. Maybe there's one letter in the acronym that you can't remember what it stands for.
Mhm.
And to ask AI to provide information about some of that might help you notice some blind spots in your work or things that maybe you hadn't thought of that other people have thought of. On the other hand, you still have the challenges of it is responding often to what the software engineer has put in, what the norm is, who it's been trained on. And there is, I think, kind of an overconfidence in its results. So I was working with a client who came in to say he did not have a particular diagnosis. He was letting me know. And I asked him a little bit more about that. And ultimately, it came out that an AI system told him he didn't have it, so he must not have it. And
Oh.
there was nothing that I could say or do as a therapist that would sort of move him away from that. So just because it's typed on a screen, sometimes people think that it is the only standard or the absolute answer.
Mhm.
And it isn't. If you put overconfidence in anything, by the way, you're going to be met with challenging results. Mnuchin talked about this years ago. He talked about when families come into a room, they're coming in with this idea of we are this, this is our identity. And the therapist is coming in and saying, no, this is your identity. And we're kind of starting at this battle. And AI really isn't different. The maybe one of the differences clients have felt that their positioning is more legitimate. They will say things like, my partner said this. Am I correct to feel this way? Am
Mhm.
I justified in my reaction? And because it's typed out on a screen, they go with it. And are we losing a level of curiosity that is necessary for people to change, therapists included? So I think the solution is we've got to pair that with some practices around cultural humility, or humility rather, community consultation.
Mhm.
What are we doing in terms of how we correct things with clients, how we express uncertainty, how we go back to being curious, how we go back to being curious. That becomes very, very important. We did not do this, I think, in some ways with telebehavioral health, which I've talked about in some of my papers. Once there was, once this pandemic hit, people were engaging in telebehavioral health. therapists who'd been doing therapy for a long time, but I bet they were not supervised. I bet they didn't go back to a stance of, you know what, this is a new modality.
Yeah.
Let me make sure that I'm doing this properly. They've been doing their work for 20 years, 30 years, right? Who's going to tell, who's going to supervise their work, right? But I think we need to. We have to adopt a stance of humility because until you understand exactly what's happening in that black box, you're really not going to understand fully how to respond to it. And that's going to further complicate this overconfidence.
I agree. And I want to just add to what you're saying that I also think that we should be active in more areas because like traditionally, like when you're in a master's program and you get your PhD, you've been told that you become a therapist, you become a, like you work in academia. I'm like, please, for God's sake, someone go to Silicon Valley or, all these startup companies.
Talk to someone, right?
Yeah, please have a like person who knows something about this area, mental health, like in your company, because it happens that I have sometimes, I live in California, so I have consultations with companies, startup companies, and they're doing all these different things. And the question that I get is like, do you actually think about clients' welfare? Like, or is it all about like generating money? Because I mean, it's capitalism. It's okay to generate money, but also like think about clients' welfare as well. And so I think that we need more people. So I tell my students today that when they ask, what can I do, with my degree? I say, yes, all these traditional things. And you can also be, content creator. You can also go to and work in industry, all these different companies. And please do that because we need that.
We absolutely do need that.
Yeah, yeah.
Yes.
I know that your time is really precious, and thank you so much for giving for to all of us your time. Is there any last word that you want to say about this topic? Because I could listen to you all day, but I don't know that you don't have that time.
Sure. I mean, I want to, I think, present a balanced message.
Yeah.
AI can do a lot of great things in mental health and particularly couple and family therapy. It can help us bridge gaps. It can help us do early warnings. It can help us learn how to do parts of our job probably a little bit better, maybe with less clerical burden to really pay attention to the work. But in order to get there, we have to really understand it. We have to do a better job about those of us who are training, understanding what exactly we're dealing with, and communicating that to the learner. And so if I could see that happen, I would be so happy.
Yeah, of course. I'm going to ask you one final question, Dr. Halden,
Sure.
because in the talks and the places that I went, and I always talked about your AI competency framework with citing you, and everyone's so it's like they're so appreciative of what the work that you do. And the question that I got the most is like, where can I learn more about that? Like, how can I learn more about that from Dr. Halden? So, what is your response to that?
Honestly, part of how I've been able to do this work is that I go to other places. I go outside of couple and family therapy, learn what's happening in the world of technology, and then translate it for couple and family therapy.
Mhm.
So I would say really start digging into doing sessions, doing seminars, learning how AI works, because once you understand that, the implications for how you can utilize it in your practice will be automatic,
Awesome.
right? It's not about teaching you how to use this tool with this particular model.
Mhm.
That's it. If you think that's what it's about, your work on it is limited. It is changing everything about what we do because it's already here.
Mhm.
So I would say go out of MFT, go out of couple and family therapy, learn about tech, and then think about then the implications for your work.
Thank you. Thank you so much. That is very helpful. Thank you so much for your time. And
Sure.
we really appreciate your knowledge and sharing your wisdom with us.
Thank you.
Thank you.